So this session is meant to be a discussion, meant to be your opportunity to ask questions of all these wonderful people up here. Maybe I'll quickly do introductions, although almost everybody here has already been introduced. So John Wargo, who's our host and professor here at Yale, Warren Porter from the University of Wisconsin, and you'll hear him this afternoon talking about lawn care chemicals. Routt Reigart, who you met, pediatrician from Medical University of South Carolina. Julia Brody from the Silent Spring Institute, who you met. Andrea Kidd Taylor from Morgan State University. And Allison Aiello from the University of Michigan. I thought I'd just get things sort of started by exercising my moderator's prerogative to ask a few questions, and then we're going to open it up for all of you to ask questions. And you can ask your questions to the whole panel or to an individual person. Let's try to be, the point of this is to be open and having a discussion, and I'm going to also, because we have limited time, try to encourage you to be short in how you ask the questions and encourage the panelists to be short in how they answer them so that we can just get more questions and answers going. So my first question, and it's really directed at everybody on the panel and anyone who cares to answer. I know that all of you, one of the reasons why you were invited to speak here at this conference is because you've done research that, at the very least, makes the pesticide industry uncomfortable, and maybe, maybe more than that. And I know that everybody here probably has a story about the kind of response that they've gotten from industry, and then how they've responded to that response from industry. And I was hoping that at least some of you would be willing to share that, because I think folks here will find that really informative to hear those kind of stories. Warren?
Okay, I work with low-level pesticide mixtures, the stuff that you actually buy, not the stuff that is registered, which is very different. And we've done a lot of work on the impact of very low-level pesticides and fertilizers on the immune, the endocrine, and the nervous systems, and have found that if you hit one of those systems, you get all of them. And then, well, actually, in the early 70s, we were working on aldicarb, a multi-billion-dollar product from Union Carbide. And by accident, and actually because I was working with someone who was working with bees, we discovered that there was a possibility of some immune suppression by aldicarb. And so we went after that with a mouse model and discovered that not only was there an effect, but it was an effect that was developing and was strongest at 1,000 times lower concentration than EPA said was totally safe. So all of a sudden, we had something that looked like it could have human population implications. And when that paper on it was ready to be published in Science, suddenly there was an immune scare in California. Farmers had discovered that aldicarb makes watermelons grow much bigger. And so, of course, they put more in the irrigation water, and then people were eating those watermelons and getting sick. And here was a paper about to come out in Science magazine saying, hey, you might also have been immunosuppressed. And we were thinking national panic. So I sent a copy of the manuscript to Lee Thomas, who was the head of the EPA at that time, and asked him to keep it confidential, but I thought they'd like to plan ahead. Well, within a week of the time I sent it to him, they leaked it to the press, accused us of publishing in the press, cut off all our funding, and we were told we were permanently blackballed, which was confirmed by subsequent DNR people who had gone to the EPA the following year on sabbatical. We've never been able to get funding from them since. That was a multi-billion-dollar product. And so what we did first was get it published. That took us 3 years because the EPA had badmouthed us all over the country. But once we got it published, then we began to ask private foundations, and I began to use my own money, my family money, to continue the research. And so if it hadn't been for groups like Rodale Institute and Organic Valley lately, and Gardens Alive, and some of the other private companies and foundations, we would not have been able to continue the research that I'm going to discuss this afternoon, which opens up an entirely new world of pesticide effects that nobody's ever even thought about before.
Is this one on? Yeah. I can't resist sharing what happens to a naive
If you hold
young-
the microphone a little bit farther down, it picks up a little better.
Does it? Can you hear me?
It just look at it. Just point it toward you like that.
Hello, hello.
Yeah. Keep it closer. There you go.
All right. Well, I was a very young guy. This was 25 or so years ago. A physician family in my community, they were treating the house for termites, and at the time we used something called chlordane. Who knows chlordane? Who doesn't know chlordane? Okay. Bad actor, very persistent, stays around 30, 40, 50 years. Potent carcinogen, we're pretty sure. This physician's family with 3 children had their house mistreated to the extent that someone in drilling to place the chlordane in the house had drilled into their heat and air conditioning ducts, and the house was full of chlordane. I mean, you cannot imagine the chlordane levels in this house, and the family was full of chlordane, which we confirmed. And they decided that this was worth, since they couldn't live there, they decided it was worth bringing suit against both the applicator and Velsicol, the manufacturer of chlordane. I was asked to talk about the health effects. So they put in this lawsuit, and my experiences with Velsicol were just unbelievable. For starts, they started subpoenaing everything in sight, including they subpoenaed my university for my personnel records to see if they could find out whether I'd done anything wrong as an employee of the university. Then we knew they had lots of animal testing, which was proprietary information for chlordane. So we asked for their animal testing, and the judge said, yes, you must provide to Dr. Reigart your animal testing of chlordane. And the only restriction is, Dr. Reigart, you can only talk about it in this case, and you can't use it anywhere else. So I was supposed to testify based on their data, but forget it as soon as the suit was over. So even then, they didn't provide the materials. They'd already tried to get my records. So the lawyers actually went to the Velsicol headquarters and stood at the door and banged on the door trying to get their records. And now we're getting very close to the trial. They provided me boxes and boxes of animal testing, which, in fact, when I looked through it, the rats weren't growing very well, and the rats were getting big livers, and we knew that liver cancers is one of the things that happened with these chemical compounds. And I started looking for the pathology. Well, they had sent the specimens off to another lab for pathology, never provided us that, and managed to delay it to the point that when we finally went to trial, I had no idea what was in those livers. I just knew they were big and lumpy. So you know, the whole process of trying to do something. Now, about the same time, the EPA was attempting to do something to control chlordane, and they said, well, we think, you know, chlordane is a bad actor. We ought to get rid of it. And in fact, the rest of the story is that when they tried to do a regulatory action against chlordane, Velsicol said, well, we're going to fight you in the courts to the death, just like they tried to fight me in this simple lawsuit. And at the time, the legal enforcement budget of, that we're in the mid-70s now, of EPA was a few $1 million, and they made the calculation that, well, they didn't have enough money to fight Velsicol, so they dropped the whole action at the time in order to not use up all their money dealing with Velsicol. The rest of the story, of course, is you're probably aware, is Velsicol was suspended for use in the U.S., but then ended up being used for another, chlordane, ended up being used in the rest of the world for another 15 years before they finally suspended production. So in point of fact, these chemicals were the companies with a great amount of money and legal resources and so forth can fight you forever until you finally win. And we did finally win on chlordane, but it was a great fight. And the family, by the way, received no damages out of the suit except they bought their house. And the judge said to me as I was testifying about the carcinogenic potential of chlordane, well, this family can't sue for risk of cancer. They're going to have to wait till they get cancer to pursue this suit. And so none of those claims were allowed. So it's a tough business. That wasn't them closing down my research, but that was them trying to prevent me from doing something good for a family that was very damaged. And it's typical.
I want to just...
Julia, just before you get started, I think John had something you wanted to say.
That's okay.
I was going to say that about 12 years ago, David Kessler was the dean of the medical school here. And David was formerly the Food, Drug, and Cosmetic Commissioner. He, of course, wrote the book Question of Intent, which is the history of tobacco regulation in the attempt of FDA to have nicotine declared to be a drug and cigarettes a drug delivery device so that FDA would therefore have jurisdiction. And we were talking about the similarities between the regulation of pesticides and tobacco products and how they use the same lawyers, they use the same PR firms, and sometimes the same scientists. And how pesticides were also added to tobacco in the field and became residues in cigarettes. And I asked him about something he'd mentioned in his book, which was his and his staff's exploration of patent data and the patent justifications for new innovations in tobacco production that include trying to genetically engineer new tobacco strains to produce more nicotine because nicotine is more addictive. So that there are literally hundreds and hundreds of patents that these companies had developed. And he said, if you really want to understand what these chemical companies are doing, you should go after the patent data and the patent justifications, which I and my research group did do. And I'll give you one example of one of the findings. We stumbled across what I call the contact syndrome. And you all know that contact cold medicine works because the active ingredients are encapsulated and they melt in your body in a time-release way. Well, the same principle was being used by pesticide companies to affect chemical persistence in ways that I hadn't understood before. And in fact, they were taking a variety of different compounds and putting them in these polymerized, tiny little microscopic, almost nanoparticle-sized beads, so that instead of spraying wet material, they'd be spraying beads in somebody's house or in an apartment or in an office. And what was so interesting about that was that they thought that it would lengthen the effective time because it would release the chemical gradually, and you wouldn't have to come back and spray as often. But given that story, what might they have missed in that ingenious design? Well, the fact that your dog, that your baby might be crawling around on the floor and picking up these tiny little beads and putting their hands in their mouths, and that there might be other exposure routes that could actually increase exposure, not just to the active ingredient, but also to the plasticizers. So it's just another example of how difficult it is to crack into the data sets that these corporations have access to. And as Dr. Reigart just said, you know, one way to do that is via litigation, but it's a very expensive and very time-consuming way to go about it. The patent approach is also interesting. And thinking about how, you know, the judge precluded you from being able to use that information in your own research. The Chinese have a system of law whereby the court does not close down the data sets. Once it's presented at trial, it is publicly available. So it's interesting the way that our system is designed to offer much greater protection to the private sector than even the Chinese government.
Thank you, John. Julia?
I love that question because, and I also enjoyed seeing the news clip about Rachel Carson being called a fearmonger because I was called a fearmonger myself just 3 weeks ago. When we published in Environmental Health Perspectives, which is the National Institute of Environmental Health Sciences journal, a study of 66 hormone disruptors and asthma-related chemicals in 50 types of household products. And within literally minutes of the scientific article being posted online, 4 press releases by industry associations had been posted asserting that we had said things that we didn't say and literally calling us fearmongers. And they controlled the Google algorithm for about 48 hours so that when you Googled me, you would get the industry press release. And I will hope there's somebody in here who knows or has a kid who knows how to do it differently next time. The question was, yeah. So, you know, the journal posts the article at midnight. What actually happened was USA Today accidentally broke the embargo around 7:30 p.m. and by 7:45, industry had posted their press releases. And, you know, the question was, how do you deal with it? Honestly, I would like someone to tell me. In the morning, our allies bought a PR newswire, which controlled the Google algorithm for about 4 hours. But they couldn't buy another one, you know. So we try to manage this by publishing our work in peer-reviewed scientific journals. It's likely that industry will submit a letter, as they always have for every article like this we've ever published, and we will then publish a reply. But I think that the disparity in resources, which has been mentioned, is so grave that it's very, very difficult to manage these situations.
Yeah.
I just want to mention one thing to follow up on that. And a similar situation happened with me, where it was to the point where if you Googled my name, period, it would go directly to triclosan, it's not harmful, and then you know, it's a click to Ciba-Geigy, the company that actually produces the chemical. So they actually can harness your information, your name, to promote their business. So, you know, it's a huge problem, and we had the same problem. No one could figure out how to de-link this information from my name after the research was happened.
Wow. You know, this technology is something else. But I just wanted to come from a little bit different perspective. My training is scientific. I graduated from Johns Hopkins. You know, I have all the scientific research background with a doctorate, and I'm an industrial hygienist by training. But I chose to focus on the policy side. When I graduated, I went right to the UAW to work for them. And I just wanted to give you an example of how we kind of worked within the system with joint labor management, health and safety committees and occupational health, where we had a board of scientists like you who received funding to conduct to conduct research on various exposures that our workers were being exposed to at the time. Now, when we got around to trying to publish that research, we did run into friction with Ford, Chrysler, and GM. We had different committees for each group. We got around that by the scientific part of it, with the scientists that were conducting the research, and the fact that the union was there to push its position on getting the research published. Now, it wasn't always easy, and there might be still an article or a couple of articles hanging around by scientists that Ford still has and Chrysler, but most of them we did get published. That's one aspect. But I think now that I've not been in pesticides for very long, right? But what I'd like for us to do with the scientists that we have, as you are conducting your research, we have to continue to work as a group to ensure that what they're doing is not masked by what happens with the companies. You know, they're big, they have all the funding, but we do have the power to make a difference. And I think that's where we have to come in to say, we want to allow this to happen. As it happens, we can make some changes. And I know Routt's, you know, he was not able to publish, and it's hard, but it's not undoable. Let's say we can make a difference. I think when we talk to our legislators, we've got the science. We have the science that proves exposure causes this risk or this health risk. But I don't think we do enough of the policy advocacy part. We leave that up to the other folks. But we have to do both of those.
Thank you so much, everybody. I have one more question I want to ask the panel, and then we'll open things up here. Thank you for your patience. I hope this has been interesting. So one thing that I've been struck with over the years that I've worked on pesticide issues is that for many of you, the research that you're doing actually concerns products that have been on the market for decades. I mean, Allison mentioned, you know, triclosan goes back to the 60s. And that's not unusual with some of our most widely used chemicals. I mean, I tend to think of glyphosate as kind of a new chemical, because when I first started in the pesticide industry, it was new, but it was actually first registered in the very early 80s. So I compare this to, let's say that technology industry or consumer electronics, where if Apple tried to sell us last year's iPad, they'd be laughed out of the marketplace. And yet the chemical companies pesticide companies invest millions in these products that are decades and decades old. And I'm just wondering, I mean, in terms of the research that you all have done, is that something, well, is it just in the nature of this industry? Is this something we can change? Can we make these companies want to be innovative and have new products, which hopefully would be better than these old things that have been around for decades? Or are they, on into the 21st century going to be defending last century's products?
I think the patent life has a lot to do with that. We've got a 20-year patent window, and the corporations will, depending on the product, will struggle to keep their product in the marketplace in the US or wherever else in the world as long as they can. They've got to recover that initial research and development cost, and that can take them 12, 13, 15 years. The difficulty here and the paradox in a way is as we demand more and more testing pre-release, their costs go up, so they've got more and more incentive to keep that product in the marketplace, even if it means that they need to litigate, which they will do. So, I mean, if they decide, if EPA starts playing hardball and tells them, you've got to stop using chemical X in indoors, well, they can litigate, and they'll buy 5 more years in order to maintain market access to get to the end of their patent life, which is like a pharmaceutical. Once the patent life expires, the product goes generic, and their profitability drops. Now, it's a very interesting question you posed. One other point that I would make is that the life of the product in the marketplace depends very much upon its duration of effectiveness. So if it's always effective against a bark beetle, then it's going to continue to be in demand. regardless of the toxicity profile and how we come to find that it's more dangerous than we thought it would, compared to the cell phone industry, which is changing so quickly that people perceive that, gee, that 2-year-old iPad just isn't effective anymore. So I think effectiveness is in part at play in the durability of the product.
Ditto. Yeah, I think it's clear also that compared to like the cell phone industry, there are relatively few players, and they're very big companies. You've met with them. They're multinational companies. The products, the older products were cheaper to make. Making chlordane, God, costs them nothing. So the longer they can go past the period where they recover the development, the better. And I think, personally, my feeling about the organochlorines is they're probably glad to get rid of them because they were so persistent. And you treat a house once with chlordane for termites, and it was good for 40 years. They were glad to move on to less persistent chemicals. So there are all these different motivations that come in. They're all profit motivated. So one of the things that we ought to be able to do, aside from regulating pesticides out of use, they go on to the next one, which is bad. You mentioned that earlier, that we keep cycling into new ones that turn out, and when we look at them, just as bad. But the process of making it more expensive for them hopefully decreases use. But I think the biggest problem is they're such big companies with so much resources, and particularly now the thing that we've thrown in is the genetically modified seed, and once Monsanto did that, all bets were off. You end up using huge amounts of glyphosate. Probably most of you are aware that they're just putting out, it's not Monsanto, it's Dow is doing the turf grass that's 2,4-D resistant. And 2,4-D is an incredibly toxic agent, potent neurotoxicant. And this is going to, and it doesn't fall under anybody's regulations. The grass, use of 2,4-D does, but once homeowners are able to use as much 2,4-D as they want on their turf, they're going to do what homeowners tend to do, which is use lots of it instead of a little. It used to be if you put too much 2,4-D on your turf, yeah, you'd kill the weeds, but you also killed the turf. So that was sort of an implicit limitation of how much got used. A side effect that I've told others this weekend is when we were taking calls through the National Pesticide Telecommunications Network, one of the calls that we got very frequently in the bad old days was that the dog had collapsed. And when the dog collapsed was after following the homeowner as they went around their yard spraying 2,4-D, because it is a very potent neurotoxicant. So if the dog was collapsing back in the days where homeowners couldn't use a lot of 2,4-D, now in a situation where their turf will be resistant to it and they use lots of it, probably we're not going to just have dogs collapsing, but children and other persons. So there's a lot of stuff that makes this, 2,4-D had faded, but it's going to come back in a big way, and it's one of the worst agents.
I just want to add that as we think about development of new products, we need to put in place some new expectations about what the characteristics of the substitutes are going to be. Because right now we have situations where the substitutes can be as bad or worse than the original product. And in particular, we need to have standards that consider these hormonal effects, the low dose effects, and effects on development. Even in Europe, where they're doing a much better job than we are right now through the REACH program, the tests currently are throwing out the mammary gland of the animal. So speaking from my own work, we would like to have some tests that look specifically for effects on the mammary gland. There is some evidence that it can be the most sensitive health endpoint for some of these chemicals. So you know, we need, as we think about our hopes for new products, we need to think about systems that drive the decision makers to make good decisions about the new products.
One last thing, beyond pesticides' goal is to not have new products, but no products.
Right, but I think from a realistic standpoint, we have a lot of products that are introduced without any kind of testing. There are millions of products that are used that we, not to say millions, but thousands of products that are used that are never tested before they enter the marketplace. So we are the human test subjects in any area, pesticides or other exposures. But I just want to go back to the question that you asked about whether companies will be defending their product. They will, as it already has been mentioned, if they're making money, and they'll defend the use of the product to the death. I'm on a subcommittee right now looking at inherently safer design for bear crop science and their use of MIC in West Virginia, where they have MIC being used to produce a lot of the pesticides. It's one of the byproducts in the pesticides, but it's right in the heart of a community. Right in the heart, the community is up against the back door of this plant that used to be Union Carbide, and it's now Bayer Crop Science. So that's one issue. But if they're using these pesticides and they're no longer using them in the marketplace here, guess where they go? They go somewhere else. They go internationally. So we have to think about that. And it's guaranteed, really, in a lot of cases, if the products are removed from this environment, they're going somewhere else. For example, DDT and the use in Africa. Now, of course, they say DDT is needed, but we also have to look how it's used and how it's used among families. So from a perspective of how we look at the industry, it's broader. They can get rid of it here, then it's going somewhere else.
Allison, do you want to talk about?
Well, I mean, speaking specifically for triclosan, we tried to sort of look at trends in advertising over time, during the period of this emergence of antimicrobial products. And it's really hard to tell, who is the driver. But we know that, during the period when HIV emerged, for example, we think that there was a sort of increase in a fear response to infectious diseases. And, probably part of that may have driven some of the marketing, and it's likely cyclical too, in terms of the drivers, the companies themselves, individuals who have the fear and feel that they need the products and so forth. But, I think it's something that we need to be thinking about in terms of what consumers feel that they need, also what's driving the production of these products and the presentation of these products as being safe and also being potentially effective, and how they're marketed. So I think it's something that's important to study and something we need to continue to think about, because that may be a place where we can kind of sort of hit it and be able to say that, we need to intervene here. The way that it's being marketed is not fair, and it's not based on science. And we see that a lot with triclosan, and I know that there's been some push to get them to stop that kind of presentation in terms of saying that these things are actually useful when they're not.
And just one very brief comment, that namely that if we can educate the public so that they're not buying this stuff, there's no company in the planet that will make it if they can't sell it.
Thank you so much, everyone. So now I want to open it up to questions, and the panel is being videotaped, so what that means is it's really good if you can get your question on the mic. So I will try to walk around and... Oh, okay. Do you want to just get her, and then I'll try to line up the next one.
Hi. So as you are all speaking and listening to the presentations this morning, I'm wishing that there was a massive PR marketing firm behind you guys. And you get money for research, you don't get money for PR and marketing. So what I'm envisioning as you're all speaking this morning is a similar body to the International Climate Panel that puts out information on climate change, an independent body of scientists on pesticides and health, with maybe some of your research dollars going into a fund and getting other funding to get these messages out so that when Silent Spring puts something out, or one of you, you're not individually attacked, and that you have the professional people that know how to get this information out to the public in a way that they can understand and tell them what to do about it. Like that list of products with endocrine disruptors, like how far and wide is that gonna go in this country? There's such a small body of us that know and track this stuff, and we're often speaking to the choir, but we need professional help in terms of how to get the messages out to the public in a way they understand. And if it's kind of spread out amongst you, it's harder for industry to come on the attack. You know, so I'd like to see something like that moving forward.
Anybody want to respond?
I agree. I think that's.
We agree.
Yeah. More marketing of the results that we've heard from today, you know, in the research. Marketing is key, and if it's among us, that's not enough. The public needs to know.
In a way they can do something.
And they can understand it and do something. That's right.
So my name is Cynthia Barstow, and I teach marketing at the University of Massachusetts. And I am working with students on a communication initiative about environmental toxins and breast cancer. So we are doing some of what you're talking about right now. But I also teach sustainability marketing, trying to get students to put on a new set of glasses so that when they enter into product development, they're considering about sustainability. But I want to tell one quick story, which is that I had a past student who is at a new company. A Badger Bomb is one of the companies out there in the industry. Met with Tom Zeller, who's one of the authors on the low dose paper, literally earlier this week on Monday. And when we sat down, this new product development young woman was talking to Tom about what kinds of tests can we do to make sure that there are not EDCs in our products. And those kinds of conversations are possible. I think that what we need to do is, one of the things is to avoid considering industry all as the big business. You have a sponsor booklet here that has Stonyfield and Organic Valley, and there's a whole entire industry of natural and organic products that are trying to do the right things. So working with those companies to ensure that we do have product development where there are no EDCs and pesticides are not being used because they're certified organic is a solution that I think is really viable. So thank you also to all the scientists who make our lives easier, because then we have something to communicate with people that really is so important. Thank you.
Anybody here want to respond? Wasn't really a question, but.
Yeah, I would like to say one point that affects all of us. There's a tipping point in organic too, and I've been figuring that once we get organic somewhere around 10 to 15% of the marketplace, which is not yet, we will have the opportunity to push the organic agenda and really push back against this stuff, but we're not quite there yet. So to the extent that we encourage consumption of organic products, we're going to get to that tipping point faster.
Somebody.
There's a question over there.
Is this work? Oh, yes, it is. Oh, hi. I'm Joyce. I'm with Clean Water Action and Coalition for a Health and Safe Connecticut. We need every single one of you, the handful of you, but very thoughtful and compassionate. I mean, that moves us all. And Connecticut was one of the first to ban bisphenol A baby bottles, bisphenol A in baby bottles. Now, it was a 3-year process, but what I was struck with was the consumer. They had no idea, and consumers have no idea. They assume that the products on our shelves have been tested. We do not use the precautionary principle, as you know. So this really is a note of encouragement. to always go forward. And, you know, every single one of you have contributed, and I use all of your information, believe me. I need to, the science of it all. So this is really a note of encouragement. It is step by step, but we have no choice. We have to go forward, so thank you.
Can we try really hard to ask questions? That would be really helpful. I appreciate all the comments, but would love to hear questions for the panel.
Yes.
Go ahead.
I've got the... okay, so I feel like a broken record, but I'm going to ask this question anyway because it's deeply important to me personally. Speaking of communications and the challenges that we face, I am a communications coordinator at a small nonprofit called Toxic Free North Carolina. I'm also sitting on the board of PANA currently, and I definitely see how we do the study and we put out the press release, and we think like, oh, here's this information, we're offering it. We don't think that we have to sell it. So I feel deeply what you guys, the conversation that's been had so far about that. On that note, I can't help but look around this room and see an absence of diversity, and I wonder how long it's going to take before we realize that we not only need to have a massive PR machine, but we also need to be doing a much more active job of including people of color and people from different political backgrounds and people from different parts of the economic spectrum. And so I wanted to ask everyone on the panel, just sort of where you see that heading. Have you seen it develop? Are there signs of encouragement in terms of engaging all parts of society on this? Because we cannot move forward. The environmental movement in general, but certainly not this piece of it, cannot move forward, in my opinion, without bringing the rest of the world along. So,
Great.
Yeah, I'll be very brief. I see in the student population, and I'm looking around the room, and there are not many undergraduates here. There are some graduate students here, but that tells me something. I mean, that tells me that perhaps the difficulty of confronting the complex scientific information seems overwhelming, I think, to many that are young. And as somebody that's worked in that arena for a long time, it is incredibly technical and scientific. On the other side of it is this phenomenal youthful enthusiasm that you see building around food. There is such enthusiasm among young people around somehow producing responsible food defined in a whole array of different ways. So that I see the bright light being the rapid growth and the future development of the organic farming movement, or the concept of, I don't like the phrase sustainable food, but food that's produced with low levels of pesticide, low pharmaceuticals, the least possible amount of energy, that is done in a way that protects farm worker rights or the producer's rights in health and safety. And also that's produced with some clear definition associated with a reasonable return to the producer. So, I mean, you could define the sustainable food idea in a variety of ways, but, my students are all over this issue, and they are deeply enthusiastic about it.
I agree. If I look around the audience and I see very few people of color, but I think the conversation is starting particularly with the students that I teach. I have 36 master's and doctoral students in the class this semester, and it's environmental health. And what I've tried to do is to combine the science with just what I've been talking about, the science with the policy, with the practice, so that they understand. Now, what generally happens, because there are 36 students, and many of them, they are largely African American. We have one Latina, we have one white. They stand out because I know their names right away. The other students I'm still learning, but I've learned everybody by now. But I'm saying that to say there's so many issues that our communities have when you're talking about health disparities in particular, disparities with food, disparities in access to food sources. So maybe we need, as a group in the environmental movement, to attach some of the problems that we face, like for example, disparities with, they call them food deserts, right? We can push organics. So, but we have to be thinking that there's a need, particularly in our inner cities, where you have large populations of people of color. So we have our work cut out for us, but it's not impossible. And maybe we need to have more of that conversation here.
Allison, I was wondering if you could just say a couple words about community-based research, since I get the point.
I don't do community-based research. I mean, I do studies of communities, but it's not community-based participatory research, I guess is how I should put it. But you know, in terms of this issue, this is a huge issue. It's something that is long-standing. It's something that we see, you know, within epidemiology and schools of public health in general. I'm on I'm a faculty ally for diversity for our school of public health, for our epidemiology department, and it's run by the University of Michigan. And you know, it's about also recruiting diverse students who are interested in these topics. And I think that's where you're going to start to see greater levels of diversity if we can achieve that. But it's a long road, and we work hard at it at the university level, but there's still huge disparities in who has access to getting into a university, who has access to assistance with test taking, to do well on their GREs, et cetera. There are huge disparities. So we'll continue to see the disparities in terms of the people who are studying these topics until we can break through that and have a diverse number of individuals attacking these issues. And they are issues that create huge health disparities. So they do contribute to health disparities. The people that are exposed are often those who are of lower socioeconomic status, minorities, of certain race ethnic backgrounds. And so we need to continue to think about that and make sure that all individuals have equal access to the opportunity of a university education and so that they can be here sitting at this table.
I wanted to mention one other thing that we're doing right now with Beyond Pesticides and the Maryland Pesticide Network. We are going out into the schools. 2 of my students are working with Matt, and we've had other people who are working with Beyond Pesticides in training high school students on the hazards of pesticide use, and actually trying to get them in the conversation of being environmental, what do you want to call them, ambassadors for the subject. So it's a start. We have several schools involved right now, and it's community-based participatory research. So that's where we're going, or trying to go.
I just wanted to say a couple words about I'm from California, and there's a study going on in California right now called the Chemicals Study, which I think is a really excellent example of community-based participatory research about pesticides and pesticides exposure. And you know, definitely we need way more of that, but and this is not at all meant to be an excuse, but when I think back like 15 or 20 years ago, it didn't exist at all. So the fact that we do have a few studies going on like that is, it is progress. Not that we don't need a whole lot more progress, but I think we can take some inspiration from the fact that it is, you know, research I think is moving in a direction that is much more inclusive of the people that are most affected.
Yes, I'm particularly interested in knowing if any of you have connected with or would have recommendations for how you all, researchers and activists, might connect better with the religious community. Very involved in environmental justice, in protecting life, and there's such a natural connection here, especially the pesticides in utero exposures to children. I work with church groups, and this is a topic we're really focused on. And at the national level, many religious traditions are taking on all sorts of environmental issues. And it seems like such a natural connection. Would you see ways to make that a really effective one so you have better, a huge community working with you on education and particularly on legislative and regulatory advocacy, because they're really waiting to be more active in this area?
I've worked little bit with some of the churches in East Baltimore. It's kind of hard because sometimes there's certain schedules that they already have. But I find that many of the churches now, like my church, we have a health and fitness ministry. So working through those kinds of avenues where they have within their community, the church community, health committees, if you can contact that group and get them involved, then it becomes a larger conversation because they're already, I know I am, and I'm always looking in the health and fitness ministry, we're always looking for topics for discussion where we can bring in an expert and get an audience to talk about certain hazards. We talk about things we've done, memory loss, which I think sometimes I have, but they tell me I'm not in that direction yet. But but we do have various topics. So I think that's one way of getting into a lot of the churches now. Some major organizations like AME, the African Methodist Episcopal Organization, because it's huge, very valuable, and they're very influential. They have a whole website where they talk about it. So getting in contact with those kinds of individuals and having persons who look like them or represent them to also be a part of that conversation is good.
Did you want to say something, Routt?
I have something to say, but I'd rather hear more questions. I think let's try and answer each question briefly.
Oh. He's got his mic here. Go ahead. Okay. Numerous communities fog for mosquitoes almost weekly from May through October. What studies do we have that show what happens to people in those communities? What recommendations do you have? How do we deal with that situation?
Wants to do. It's a problem, particularly the use of malathion routinely. I personally was involved back when we first started worrying about the mosquito-borne illness in New York City, and they wanted to spray all of New York with malathion. We managed to help them back down on that by press activity. It's a problem. At the time I was on ABC or NBC, something like that, but managed to get them to back down on spraying all of New York for get rid of West Nile, which really was dumb. So really, that's one that you have to deal with often locally. You have to say, okay, in my community, I don't want you spraying me with malathion, and there are definite health effects, particularly great allergic agent, makes wheezers wheeze, as well as its direct pharmacologic effect. So that's when you push back locally, seems to work reasonably well.
Hello? I'm sorry.
Pardon?
I'm Sylvia Knight from Vermont, and I worked with the Vermont Pesticide Advisory Council as a lay volunteer, unpaid, for about 17 years, trying to raise consciousness on that board. And I have a situation in my neighborhood that involves low concentrations of sulfonylurea herbicides, and they're being dismissed by the state. And I understood that there was going to be some address to the issue of low concentrations and mixtures in this panel. And as an aside, I wanted to ask you which one of you I should talk to about at what age there's a maturation of the immune system in the child. So that's a separate thing. I could deal with that later. So I'd like to hear somebody talk about how I can address the low concentrations and their importance in mixtures. Thank you.
Okay, anybody willing to take on that? Okay.
Sulfonylureas are really nasty partly because they are so incredibly potent. One of the arguments you might want to use when you discuss this with people is that we function in the parts per trillion range in terms of our hormones. Women going through a monthly menstrual cycle will start at 40 parts per trillion of estrogen. And what that does is it inhibits the brain from releasing chemicals that cause ovulation. As the menstrual cycle or the monthly cycle progresses, the woman eventually will reach a concentration of about 400 parts per trillion. And when she does that, she reaches a tipping point where the brain completely reverses its response to estrogen, and now you have a sudden flooding of ovulation hormones to make that egg go out. So in terms of human function, we are working with all kinds of chemicals in our body that where we were responding in the parts per trillion range, this is typically about 1,000 times lower than EPA ever looks at under any circumstances, and most researchers won't even get down there. And so things that like sulfonylureas that are working also in those concentration ranges can look like a pseudohormone, and they can interfere with nervous and immune functions as well. And I'd be glad to talk with you some more about that in detail.
Anybody else want to? Next question. Who got?
I think somebody should be on this side. Someone over there? Maybe? Okay, I guess I'll just go for it. I'm Charlotte. I'm here from Brown. And I guess I had more of a question concerning the moral aspect of the whole organic movement, and I guess what your perspectives are, if it's important to keep it as kind of a movement where it's, you know, important to have social justice and be fair with the land and work with the land, or if it's just better to have everyone participate in it and grow it and make it more of an industry, I guess, instead of a movement, I guess, or both.
Anybody willing to take that one on?
Yeah, I would. I think I'd repeat what I just said, which is that it needs to be not viewed as fringe, but this is, organic is the mainstream and should be the mainstream. We've, at other sessions, for instance, heard from the Rodale Institute that organic methods can grow food at least as cheaply with the same yields as chemical methods, and under many circumstances more cheaply with higher production than chemical methods. And you know, the more we look at organic systems properly done, we realize that there was some discussion about cost disparities. That really shouldn't be there. That as we get to that tipping point of enough organic where we don't, you know, one of the real moral inequities, if you will, is the U.S. subsidizes chemical agriculture but doesn't subsidize organic. Crazy. Why should we subsidize use of chemicals but don't subsidize and support organic? And that's why I said a while ago, we get 10 to 12% organic, then there's that enough of a lobby, enough power, enough strength in organic to force more logical policy decisions. Does that sort of answer your question?
I wanted to add to that is that I know one of the problems with a lot of organic foods when you're talking in inner city is that they cost more. And I've seen products starting to go down. But also think about the small farmer. Particularly in Baltimore City, we have fresh market places, and farmers come in on Sunday and Saturday and have open markets, and they do reside in the inner city so people can come and purchase fresh vegetables. So when you take away the term organic and just say fresh, sometimes that can have a better feeling. And many of those are not farmers that are using pesticides in their production. So that, I mean, that's another way of looking at it. So eventually, maybe we'll have more of that. And some are growing their own foods more.
So my name is Ellen Fine, and I was living in New Hampshire until, well, quite literally, I got pesticided out of the state. We can tell that story at another time. I'm currently living in a town in Massachusetts called Needham, where about every third house has a little yellow flag out in front of it, meaning broadcast lawn care. Upwards of 19, 20 chemicals going on in all of these houses. And then there's the do-it-yourselfers who are, blasting their trees or coming out and dumping an entire bottle of Roundup on their property. So we actually have a meeting with the Board of Health in a couple of weeks, and I actually left a public building in town and got pesticides sprayed on me, got quite sick, so now they're actually listening a little bit. So part of the problem in the research is that there's a lot of research done on farm workers, epidemiological applicators, hort workers, but there's not great research on the lawn care pesticides and the effects of the children who, we extrapolate out, but we never kind of do a research that says, okay, in this community, 20 houses use lawn care, and we looked at what was going on in those homes, and specifically at those pesticides beyond glyphosate, 2,4-D, a little bit of dicamba or neonicotinoids. So I'm wondering where you could point me to for that research. And the second part of the question is, the third part is please come to Needham and talk to our Board of Health. And I know somebody up there lives in Newton, so it's a possibility. But what are the kinds of things that you would really talk to that Board of Health doc that thinks that he or she knows everything there is to know about public health? They might advocate mosquito spraying. They've never heard that there could be health concerns with pesticides. They might not even know what an endocrine disruptor is. So those are the questions.
Your response to your people, your board, might be, do you know what the #2 place in the country is for breast cancer in women?
Actually, we were #1 for 5 years.
Are you?
And then Connecticut, and we go back.
Okay, well, the number 2 place is Whitefish Bay in Wisconsin, where you have no pesticide companies anywhere near, except that they put them on all the lawns, and there's no industrial source. The other really big place is on the north side of San Francisco Bay, where there's a huge petrochemical operation, and the people in that area also have huge breast cancer rates. And so when you look at these 2 locations and see this enormous difference in industrial complex versus wealthy people who are putting it on all the time, and there's a woman in this audience, Amy Joyce, right there, who's been working in that area for some time, and she can give you a lot of information about what's happening to the health of the women there, and it is not pretty.
One point that you might make is that the largest pesticide producers in the world are producing both pesticides and pharmaceuticals. Biocides are biocides, and many of the same chemicals are licensed as pesticides and as pharmaceuticals. Yet think about how we manage pharmaceuticals. Doctor has to prescribe the pharmaceutical, gives you a very specific dose. Then we've got the pharmacist, who is the deliverer of the material to you. So there are 2 layers of expert protection to try to manage exposure. Whereas if the same chemical might be sprayed on your lawn, it could be sprayed, even if it's a restricted use chemical, by someone who doesn't even have a high school degree. They may not even be able to figure out how to mix the concentration the way specified on the label.
Could you be specific about the particular pharma chemical?
Syngenta makes atrazine, and they also make tamoxifen.
Syngenta.
Syngenta, in Switzerland.
Is there a lawn care one? Because I know atrazine isn't used as much on the lawn care. Is there a 2,4-D or glyphosate or that in that?
2,4-D has dioxins in it.
Great, thank you. And we have another question here, I think.
Thank you, panel, for your wonderful information. My name's Ann Berman, and I live in Milford, and we have been advocating no pesticides, chemical fertilizers since 1996, but that doesn't mean the whole town has complied. I would like to, my question is, it appears that most chemical companies are bereft of any ethics. So I'm wondering why it is that the EPA or some other organization in the federal government hasn't made it more stringent on anything chemical that comes on the market, pesticides, you name it. Why isn't it they don't have to go through the same thing that the health department goes through when they test a drug? Why are the requirements so low for trying to protect us from these chemicals?
Anybody want to take that one on?
I do know that there's a couple of advisory boards that really are looking to just that point right now. There's an EPA advisory board. There's a group, it's Public Health and Chemical something, and it was the National Conversation on Public Health and Chemical Exposures. There are recommendations that are made in that same direction on how we should be looking at chemicals before they're actually introduced to the community. How far we'll get with that is a different question, but there are some groups and advisory boards that have done some investigating and reports. And you can go to the National Conversations website. It's through CDC and ATSDR.
I'd just say briefly that among the 100,000 chemicals that are in international commerce, the best tested chemicals are pharmaceuticals. They go through human trials before they can be released to the public. After that, I would say pesticides would be the next best tested class. They do not go through human trials, and there's been extensive debate about the ethics of human experimentation with pesticides. And you can raise interesting questions about, well, if the same chemical is being used as a pharmaceutical, and why wouldn't you allow human testing? But the consensus among a variety of ethicists and expert panels and politicians that eventually are making the decision in Washington has been that it is not ethically responsible to use human clinical trials to pesticides. So that explains some difference between the two classes.
Just to comment on that before we get away from it, there is a final rule on human testing for pesticides. It's been sitting in EPA for about 3 years and hasn't yet been released. So who knows exactly what that's going to look like.
I just want to add that one reason that ethicists are in that place right now is that you use pharmaceuticals primarily because there's something wrong with you. And so your hope is that the benefits will outweigh the risks, whereas chemicals that we're using in consumer products, that you don't have the potential for benefit that you have from pharmaceuticals. I'm not saying I know the answer to this, but that is one reason they're treated differently.
Okay, I've got to make one more comment. I'm sorry to drag it out, but I was on the first EPA panel on human testing of pesticides, and the panel as a whole decided that under some conditions you could test pesticides in humans. Dr. Herb Needleman and I submitted a minority report in opposition to that position because we could not imagine the situations under which it would, for lots of reasons, both scientific and ethical, where it would be appropriate to intentionally dose humans with pesticides. So I was on the minority report. They got upset about that and kicked it to the National Academy of Sciences. It's been round and around for 10 years now, and we still don't have a final rule.
Go ahead.
Dr. Wago, you point out in your book that chemicals that EPA has decided to sunset, like diazinon and chlorpyrifos, are sold in stores even after the sales prohibitions go into an effect. And that it makes me wonder why we can't have recalls. Think of all the publicity that comes whenever there are recalls. of products that are not?
It's a good question. Well, you know, these chemicals have been licensed for long periods of time. Diazinon, chlorpyrifos are good examples. The evidence eventually mounts to demonstrate they're more dangerous than we thought previously. And between the time that there is consensus in the scientific community that that is the case, that the risks are excessive, and the time that they are actually removed from the marketplace is immorally long. And it's driven by a variety of different factors, including litigation, but also EPA's willingness to allow the continued sale of existing stocks. Even though they have the legal authority to suspend use immediately and to remove all products from the marketplace. So, you know, basically what I'm saying is that the combination of litigation and politics is, you know, it drives continued exposure.
Could I, we're running out of time, and there's something that came up earlier that I can't sort of leave sitting on the table, which is the use of DDT for mosquito control, which is still being pushed greatly. And I would direct you to do a literature search under the name of Routt Reigart, who's an epidemiologist at NIHS. Walter did a financial, economic analysis of the use of DDT for mosquito control in the context of his research, which had shown that DDT exposure, and particularly DDE levels in women, shortened the duration of lactation. And when he looked at the benefit of continued lactation, particularly in developing countries, versus the benefit, the incremental benefit of using DDT for mosquito control, he found out it came out at least even. The use of DDT benefited them no more than a full duration of lactation. And so that you could make the argument that the benefits of continued lactation overweigh the benefits of using DDT for mosquito control, particularly when there are other methods of doing it. So I think, you know, and again, this is an endocrine effect of one of these halogenated hydrocarbons that we shouldn't ignore.
We're going to do just one last question because lunch is happening out there, and it's a great lunch, and we also have speakers who are going to be talking during lunch. But you want to just ask your question and then...
Thank you. I'm wondering about the pesticide Garlon, and I don't know the scientific components or name of it, and specifically its use in invasive species management. The nature preserve I work in uses small amounts of Roundup and Garlon to treat honeysuckle and bittersweet, as well as other invasives. And I was wondering about the effects on health of those in very small amounts, as well as other methods of invasive species control, and kind of what the balance is there between the environmental impact of the invasive species versus the environmental impact of the chemicals.
Can I talk to you during lunch? Yeah, does that work? Okay, great. Does anybody want to, do a short, quick answer to her question, or I think it's pretty detailed, and yeah. Okay. Well, thank you so much, everybody. This has been a great panel, and thanks especially to these folks here.